proteins have two types. One is the albumin, which is very specific, and total proteins are many proteins including albumin. So the total proteinuria normally is 150, more than 200, 300 is abnormal, and albumin is only 30. So as one grows older, as you can see that the frequency of albumin in the urine increases, the leakage increases. And the other way of assessing the kidney is the structure by simple ultrasound. So that's also a very simple way of assessing the kidney structure. Now, as I said, the simplest test which we do in the lab is the creatinine. But creatinine is not a very good marker. The creatinine is produced from the muscle continuously. All of us make creatinine from the muscles. So the amount of creatinine which one produces will depend upon your muscle mass, as I'll show you a figure subsequently. So if you are a really stout person, then you'll be producing more creatinine. So even if your creatinine is a little high, doesn't mean you have kidney failure. On the other hand, if it's a thin lady, old lady, having hardly any muscle mass, even a normal creatinine, normal as per the lab parameters, the bracket, may be abnormal. So that is very important. And that's why this concept of eGFR came up. As I said, GFR is something which we want, we cannot get it. So now we have the eGFR. And eGFR stands for estimated GFR. So it's just an attempt to estimate what the GFR probably is. So this is the concept which is now very important, is the eGFR. As I said here, as you can see here, that if a stout male has a creatinine of 1 and an old frail lady has creatinine of 1, it's not the same GFR. We are looking only at the creatinine, but what we want is the GFR. So this concept of eGFR has now been taken up. So what we can do is, there's a computer program. This is you can go online, and mdrd.com is the site, and this will open up. So you have to just put in 4 things. One is your age, your race, either you are a black or you are not a black. So we are all non-blacks, the gender, and your age in years. So if you put in these 4 parameters, you will get your eGFR. This is also a little complicated. Who wants to go on the web all the time? So the simplest now is that we all have smartphones, so eGFR can be just downloaded, and the same 4 parameters can be put in, and you can calculate your eGFR from your serum creatinine. So depending upon your age and your gender, it will give you a reasonable idea of your kidney function, which, as I said, should be around 100, but it may not be that way. Right. So now we'll just see what happens with aging. So this is, on the top is a normal kidney. You can see those round things are the filters. As was rightly mentioned, we have 1 million nephrons, 1 million filters in each kidney, and that's how a cross section looks like. And if you see closely there, there are round loops like this through which the blood flows, and the filtration takes place from there. And what happens with age is that, as you can see here, parts of it get clotted. So it's called the nephrosclerosis, the kidneys are getting clotted. So it's an aging phenomenon normally, whereby many of the nephrons become non-functional. So that's a normal aging process, which can sometimes be more accelerated. So that's how the kidneys age. And as you can see here, that is glomerulosclerosis, there's a medical term. With age, almost 15-20% of the nephrons normally die out. Now coming to the GFR, we were interested in the GFR. So as you can see from this slide, the normal GFR is 120, that's the green line, the median value. With age, see how it drops even normally. And by the time you're 80, 90, your GFR. In fact, the problem with this is that in our Indian population, we have done studies ourselves, we are not 120. Our normal GFR in healthy young people is only about 80, 85. So we start already there. And then it goes down. And as you can see in men, so by the time you are 90, your GFR is down to 40. And if you are diabetic or hypertensive, then things can get much worse. Right. So now coming to the definition of CKD, which was mentioned. So basically, CKD means that there is a reduction in GFR. Okay, and this reduction is long standing. We're talking of chronic. So it's for more than 3 months. So first come to the second part of the definition. That's more simpler. So if the GFR, which should have been 80 or 100, whatever, is less than 60 for more than 3 months, that is CKD. Okay, so that is a period.